We've come to review the refurbishment of Lagos Island General Hospital. We've been working on this project with GM Lasiama, the agency responsible for maintenance, and with a consultant contractor, HK Designs. We've done extensive work here in phases because this is a very busy hospital. So it's been very difficult for us to do the refurbishment all at once. So the actual time frame of activity is protracted because we have to maintain the clinical services that are being delivered here. So between the MD and the project manager and the contractors, they have to phase out the refurbishment in such a way that we can do things without interfering with as much as possible with the day-to-day activities of the clinic. 250 beds, more than 20 medical disciplines are being serviced by this general hospital. Its catchment area is very wide. It goes beyond Lagos State. So it's a very strategic medical institution as far as all our general hospitals are concerned. So the plan is to completely refurbish the entire hospital, and that will take about 2 or 3 years for us to do that. How is the treatment going?
It's fantastic.
My daughter is a sickle cell patient.
Yes.
And we've been using Mercy from Mercy to General Hospital. So we came with pneumonia, lumbar pneumonia. She was in emergency with oxygen, but thank God today there are no more oxygen, and she's doing well. And I believe very soon, by God's grace, we will be discharged.
So you are
and
very.
the way they take care of patients, wow! Even the nurses, in fact, I've not seen general hospital like this. We used to say government hospitals they are not doing it, but here there's an exception.
Outside, I used to convince people that they are doing well.
They are really doing
So
well.
this is the chief doctor.
Okay.
Oh, good morning.
Karimu. Okay. So I witnessed an accident on the 3rd Mainland Bridge, isn't it? Yesterday. Okay. How long did it take for the ambulance for them to attend to you at the site of the accident? 10 minutes. Okay. So we put a call to Lasambos. I spoke to somebody and they told me that you are going to disperse an ambulance from base 2.
Yes, sir. Which we need.
Base 2 is where? Okay. So you have an ambulance bay here called base 2?
Yes, sir.
Inside the general hospital?
Yes, sir.
Okay. This base 2, how long has it been there?
We've been here for long, sir. Over 15 years now.
15 years. But you've recently undergone renovation.
Yes, sir.
What kind of renovation have you undergone?
It's on they instruct a new building, actually.
Has
Not
it?
Actually renovation, but
A brand new building?
brand new building.
A new model?
Yes, sir.
It's called an ambulance bay.
Yes, sir.
How has that affected your functionality?
In fact, it really helped us a lot, sir. Most of our staffs stays, those that were on call, always till done. Any moment we are at alert, ready to move. So it really
Has helped your efficiency?
Yes, sir.
So after I called you yesterday for this accident, what happened?
Immediately you called,
Yes.
we picked up because we are ready. Whenever we hand over in the morning, we are always at alert.
Okay.
The moment any calls comes in, we have to move immediately.
Okay.
It wasn't quite 5 minutes when we got to the scene of this accident. Actually, because of her injury, she's been picked by a private vehicle.
Okay.
When they saw us going, they have to wait.
Okay.
So we picked those 3.
Okay.
Then we later come down to her where they stopped. So we picked her
Collected
from them.
her and you brought her here.
Brought her.
So you sustained some injuries in that accident. But how has been your care? Are you okay now? You are still in pain. When are you going to discharge her?
We are actually waiting for her to do an X-ray of the hand to rule out the fracture.
They're very happy with your ambulance base, obviously you can see, and it's made them more efficient.
That's good.
So can you tell us the genesis of this new prototype that you designed and what you plan to do with it in the future? And how many types of prototypes do we have?
So we have 2 types of prototypes. We did this design because we wanted to increase response time.
Okay.
It was really to attend to emergency response time to make sure we increase it. We did an assessment. Currently we're building 6 prototypes in different areas.
In general hospitals?
In general hospitals. We also have another design so that we can have one in every local government. So the first phase is the ones we're doing in general hospitals.
And what's the one that's going to be in the local government? What's that called? It's another ambulance bay.
It's also an ambulance bay.
But
it's a
smaller one.
It's a smaller one.
In every LCDA?
Yes.
I can say that this hospital is very dear to the heart of the governor of Lagos State. You know, he is right next to the State House. So he comes here regularly and is very, very keen to see that this facility undergoes complete, absolute transformation to bring it up to international standards and to increase its capacity to serve the citizens of Lagos.